All right, so today we're going to take a journey into our own minds. We're talking about psychodynamic therapy, which is really all about uncovering those hidden forces that, secretly shape our lives.
I mean, have you ever just stopped and asked yourself, why does this keep happening? Why do I always end up in the same kind of relationship or face the same challenges at work? Reacting in these self-defeating ways again and again. It's such a common human feeling, right? And that's exactly the question, the problem that psychodynamic therapy really dives into.
So, to start figuring out these patterns, we have to look back. We have to explore where they actually come from. And that brings us to this core idea, our hidden influences. It's this concept that our past, it's not really past, it's right here with us, in the present, shaping who we are in ways we often don't even see. Okay, so a huge, fundamental idea here is that our childhood experiences literally shape the adult we become. Think about it. Those early relationships, especially with our parents or caregivers, they create a kind of blueprint. And that blueprint, it doesn't just disappear when we grow up. Oh no. It becomes the very foundation for our personality, what we expect from others, and basically how we move through the world as adults. And here's the real kicker, the crucial part. These powerful forces from our past, they aren't obvious. They live on in the here and now, absolutely. But they do it from the shadows, outside of our awareness. They're like these invisible strings being pulled behind the scenes. And that's why we can feel so stuck in a pattern and have absolutely no clue why it keeps happening. All right, so if all the answers are hidden, where on earth do we even begin to look? Well, that's what this is all about. It's a journey into the unconscious mind. This is the place where the therapy really focuses all its energy. When you boil it all down, the number one goal is actually pretty simple to say, but really profound. It's all about making the unconscious conscious. That's it. It's about taking all those buried motivations, fears, and memories, things we're not even aware of, and dragging them out into the light so we can finally look at them, understand them, and, actually work with them. You've probably seen this before, but it's the perfect way to picture it. The iceberg metaphor. So that little tiny tip you see sticking out of the water, that's your conscious mind. It's what you're thinking about right this second. Then, just below the surface, you've got the preconscious. These are memories you could pull up if you tried. But that massive, gigantic part of the iceberg, hidden deep underwater, that's the unconscious. And it's packed with all the deeply buried experiences and feelings that, believe it or not, are still having a huge impact on how we act today. So, okay, how does a therapist even begin to navigate this inner world? Well, you can think of them as a kind of guide. They're looking for specific landmarks, key things to focus on to help map out this hidden territory. One of the first things they look for is what's called affect. Now, that's just a clinical way of saying your emotions, the whole range of them. And we're not just talking about feelings like, oh, I felt sad. It's about helping someone truly feel their feelings and find the words for them. Even the really difficult, confusing, or contradictory ones, maybe feelings you didn't even know you were having. The goal is to get past just thinking about it and actually get to a real deep emotional insight. Then, of course, there's identifying those patterns we mentioned right at the start. The therapist helps you become a kind of detective of your own life. As you talk about your thoughts, your feelings, your relationships, these themes start to pop up. Maybe you notice you're always drawn to a certain type of partner, or you have this habit of sabotaging things right when they start going well. The therapist is there to help you connect those dots, so you can finally see the cycle for what it is. Okay, and this is where things get really fascinating. All those patterns in your relationships with other people, sooner or later, they show up right there, in the therapy room, with the therapist. It's a concept called transference. So, for example, you might find yourself getting really defensive with your therapist in the same way you did with a critical parent. And what's amazing is that the therapy relationship itself becomes this safe little laboratory where you can see these patterns play out in real time and then start to change them. So what are the actual tools a therapist uses to bring all this stuff to the surface? Well, there's a specific set of techniques, almost like an explorer's toolkit, designed just for this kind of deep dive. First up is something called free association. It's pretty simple. You just say whatever pops into your head without censoring anything. The idea is that it lets these unconscious thoughts sneak past your normal mental filters.
Then there's dream analysis. Dreams are often called the royal road to the unconscious because when we're asleep, our guard is down and all this repressed stuff can bubble up in symbolic ways. And finally, the third step is interpretation. This is where the therapist helps you put all the pieces together, the free association, the dreams, the patterns, and helps you understand the hidden, unconscious meanings behind it all.
So we've gone on this journey, we've used these tools, but what's the point of it all? What's the ultimate goal of all this deep exploration? It's about getting to a deeper insight.
And this is so important to understand. The goal isn't just to fix a problem or make a symptom go away, like getting rid of anxiety. It goes way beyond that. The real aim is to actually build something positive. It's about fostering new psychological strengths and resources, things like being able to have more fulfilling relationships, developing genuine self-esteem, or having the resilience to handle whatever life throws at you.
I think this quote really says it all perfectly. The goal is to help patients free themselves from the bonds of past experience in order to live more fully in the present. That's what it's all about, isn't it? Freedom. Freedom from those invisible chains of the past. So you're not just replaying old scripts. You're actually free to make new choices and live your life right now, in the present.
So I'll just leave you with this to think about, a question to kind of mull over for yourself. As you go about your week, think about your own life, your relationships, the way you react to things, and just ask yourself what patterns from my past might still be living on in my present.